Hi there, my name is Al. Graduated from pharmacy school a long time ago and became involved in a variety of things. I served on what was known as the Pharmacy and Therapeutics Committee, which decided which products were available on Medi-Cal. All of us who were on that committee were volunteers, we were all pharmacists. And one of the things that we did is we pushed for a broader base of pharmaceutical companies to have to actually bid or negotiate to put their products on the formulary. They screamed like banshees until they realized, you don't want to play with us, you don't get on the formulary. And one by one they came on. And Big Pharma, we probably saved at least half the money that would have been spent. And we need to expand that into all of the drug programs that are out there. Months back, candidate Obama was on a rope line in Ohio, and some brilliant guy called Joe the plumber made a comment, well, that sounds like some killer. He isn't smart enough to pay his taxes or even become a plumber or buy a business. And ever since Joe the plumber, the spokesperson for the Republican Party at times, created the word socialism, everything seems to be called socialism. Right now, the insurance companies are all for-profit corporations. I was an entrepreneur for 35 years. At home in my office, I have a sign that I proudly display. It says, profit is not a four-letter word. And I believe in that strongly. But in healthcare, when healthcare insurance companies are for-profit corporations, we know that corporations are mandated to make a profit. And the way you make a profit in a corporation is to cut expenses. Well, it's one thing if you're Dell Computer and you cut expenses, but if you're a healthcare company and you cut expenses by dumping those who have cancer or pre-existing conditions, or you go back, as the gentleman from Cigna testified to about a month ago, and you start dumping people just because they made a mistake someplace, that's how you cut expenses. Moving on. What is known as a single payer system, which means that all the bills go through one place, and you got a real good handle as to who's charging for what, and suddenly all the people are charging too much, like Big Pharma. Suddenly we're watching them. Years ago, my wife and I went to an attorney. We spent about $400 or $500 to redo our wills and things, and we created something known as an advanced health care directive, which spells out what we want done if we're laying in a hospital bed with bunches of lights and tubes and things flashing. We're very clear. In the new bill, what I discovered was the government would have paid for that for me. They're not going to push me down. The choice is mine, but that's what I get to do. Yeah. Thank
you. Good evening, everybody. My name is Brian Sullivan, and I'm born and raised in California. And I've been lucky enough to grow up in the greatest country in the world. And it's due to many of you here, especially those who are older than me, have paid your taxes, have worked hard, and I've been very, very blessed. I want to thank everyone. And the reason I'm here is my children, I have 5 children, look to me and say, Dad, what is the future going to be like for me? And I'm very, very worried. If I go back and I say, how much money did the government spend in 1998? The federal government spent $1.7 trillion. In 2010, the government is projected to spend $3.5 trillion, double than what they spent 10 years ago. We're all here talking about health care. My daughter just graduated from college, was fortunate enough to get a job. I'm worried about the security of our country. I'm worried that in 2010 we're going to spend $250 billion on interest on the national debt. So I'm wondering, what can I do? And I'm considering to make some important life decisions because I want to give this country to my children better than what I have. And I have no beef against Louis Capps. Louis Capps, I think, has been a wonderful public servant. She's, given her life, or the last 10 years of her life to that. But I do think we seriously have to consider, is the current Congress working? Or is the current incumbents in there, are they working? Do we feel that they're working in the best interest of all of us? And my opinion is, maybe we all have to consider in 2010, we have an anti-incumbent wave, and I think maybe we turn this country back to the people. Thank you very much.
Hi, my name is Walter Heath. I live in Morro Bay. I spent a delightful couple of hours with Chris on the radio. And I just wanted to make a couple of points here. If we were to have a vote here tonight, how many people would want to get rid of Medicare right now if we could get rid of Medicare? How many people want to get rid of Medicare? Okay, so we got one who wants to get rid of Medicare. I got maybe a couple here. You know, Medicare does a pretty fair job. According to their data book, last year they spent about $7,500 per capita per beneficiary. That includes a lot of end-of-life care, a lot of expensive care, $7,500 per capita. We spend as a country on health care $8,500 per capita. So Medicare's not doing such a bad job. There is a solution. Let people who are not yet Medicare eligible pay into the system. There is an option. It's a lot simpler than the bill that Chris has. For 3.5% of top-line income, all your medical, all your dental, all your vision, even long-term care, all your pharmaceuticals, everything, 3.5% of top-line income, no deductibles, no co-pays. The bill is called HR 676, and we should all support it. And I'll tell you why. We should all support it, and I'll tell you why. It would be a boon to Medicare. It would put money into the system. Tort reform would go away because 80% of legal judgments in tort cases are for future medical costs. So you're always trying to chase that inflated medical cost. Goes away, not a problem. There would be a boon to Medicare, it would be a boon to the health of the country, and it would be so simple. Just let people buy into Medicare.
HR 676.
Well, HR 676 sounds pretty good, but I just asked him if there's a cap, and he said no. And my name is Dory Swinger, and I want to thank you all for coming. I think we're all very passionate about our beliefs, and I think it's wonderful. This is about what the United States of America is. We can all talk about it, and I'm very happy to see how respectful everybody is of everyone. You know, it's not about politics. This is about health care. I think we all agree that Medicare is doing a good job. The only problem is it's going bankrupt. One of the problems is there's no cap, and I think anything we look at without a cap is a problem. I think people can pay money to raise that cap so they can always have it for that catastrophic health care that they might need. I believe in reform. What happens? Right now we have a very large deficit that's growing day by day. And what happens when the government is control of our health care and they go broke? Our financial crisis becomes our medical crisis. And then who decides who's going to get what? That is my concern for all of you, for my children and my grandchildren. I support reform. I like tort reform, insurance reform, getting insurance from across the states. I want to offer solutions. I don't want to complain about things. I think we have the best medical anywhere, but it is expensive. And I think what we want to offer is solutions to that. You don't throw the baby out when you throw the bathwater out. And we've got something to work on, and let's reform it. Thank you all.